Anybody who wants to represent the group? Okay, Christy, do you have any reasons why you feel that way?
I feel like even though the kid is going to have some dependency on other people for their life, they still deserve to be born. It's not like their life will be totally miserable as well. So,
Okay, so I
and
think
also
we
like even in
okay.
3 months, if the mother finds out that the child has Down syndrome, the mother already has developed some, connection with the child inside the womb. So I think it is hard for the mother also.
So she feels that it's emotionally difficult. And I think we saw a very good example where a person is winning an award, even though after being diagnosed with Down syndrome. So we see that some people are doing very well. So I think there's no right and wrong to this theory. You can have your own thought pattern on it. Those who say abortion is a good option, for them, you are correct, because you may have your own justifications for that. And those who feel no, the child should have an opportunity to come into the world, to experience the world, because no matter whether it's 2 to 3 months, the child is already living, the cells are already living. So whether you terminate or not, life has already started, and therefore, how whether we have the right to terminate a life that has already started is $1 million question. But you see, both sides are correct. For both answers, I think there's enough logic. It ultimately depends upon personal preference and personal choices, personal circumstances will determine what they are going to do. So let's carry on with our topic. We'll look at the next disease now. We were looking at Turner syndrome. So let's go to Turner's. But before we go to Turner's, let's look at the next genetic disorder, which is known as Klinefelter's. Okay. So what we found was Turner's was occurring only in the females. And what was happening in case of Turner? Okay, let's go to Turner once, and let's go to Turner.
Hello.
Okay, let's go to Turner and let's recap Turner once before we actually go to Klinefelter. So what we found is in Turner syndrome, we are finding that it occurs only in the females. And what happens in females, we are supposed to have 44 autosomes and 2 sex chromosomes, that is an X and an X. There are supposed to be 2 X's in the sex chromosome. But due to, again, faulty meiosis that takes place, what happens is a child who is born with Turner syndrome ultimately lands up with only one X chromosome. The other X chromosome is missing. That means one of the egg is getting 22 plus O, there's no X chromosome, and the sperm is giving either 22 plus X or 22 plus Y. But in case of female, it has to be an X, it cannot be a Y, or it can be a normal egg and an abnormal sperm. So the abnormality can come from the sperm also, the abnormality can come from the egg also, but normally the abnormality is there in the egg, where one of the X chromosomes are missing. And when one X chromosome goes missing, what is the combination that takes place? 44 plus XO. There's no other X chromosome. So instead of having 46 chromosome, this individual has only 45 chromosome. And this condition is known as Turner syndrome. Now, we saw that in case of Turner syndrome, since they lack one X chromosome, their feminine characters that are supposed to develop, the secondary sexual characters that are supposed to develop, is poorly developed. For example, the menstrual cycle is problematic, the ovaries and the breasts are very poorly developed, the secondary sexual characters are not well developed, and they usually tend to be short in height. They have a very broad neck which is usually called a web neck. They have more masculine features because the feminine features are missing. So let us again watch a video on Turner syndrome to just recap what happens during Turner syndrome. Okay.
Hello. In this health sketch, we want to talk to you about Turner syndrome. Turner syndrome is a genetic condition that only affects girls. It's named after Dr. Henry Turner, who discovered the syndrome in 1938. On average, for every 2,000 girls born around the world, one of them will have Turner syndrome. Why does Turner syndrome occur?
I want you to take this average down. Please write 1 in every 2,000 births can have Turner syndrome. Okay.
Unlike other genetic conditions, it's not inherited from parents and has nothing to do with a mother's age or environment. Instead, it happens randomly based on how a girl's genes are first formed. Our genes are like a code which determine how we look and how our body works. All of these genes are wrapped up in 46 chromosomes, which are found in every cell of the body. Of these 46 chromosomes, one pair is different between boys and girls, the sex chromosomes X and Y. Boys have an X and Y chromosome, while girls have two X chromosomes. In girls with Turner syndrome, the second X chromosome is missing or altered in some way. Because of this, their body develops slightly differently. The syndrome is very variable, and some girls have very few symptoms. So what are the common features of Turner syndrome? Nearly all girls are shorter than average, and their ovaries don't work properly. The ovaries make the hormones estrogen and progesterone. With less of these hormones, girls with Turner syndrome may not have a growth spurt and may not have periods as usual. There are also other more subtle physical differences, for example, having a wide neck or slightly puffy hands and feet. Sometimes these features can be picked up on a pregnancy scan, but Turner syndrome is usually diagnosed after birth. In fact, diagnosis can happen at any age, and because the main features only occur at puberty, some girls aren't diagnosed until they become teens. The test for Turner syndrome involves analyzing the chromosomes from a blood sample called karyotyping. There are also other symptoms that may occur with Turner syndrome. These include weaker bones, hearing difficulties, or problems with the heart, kidneys, or thyroid gland. There may be specific differences with behavior or learning, but overall, intelligence is not affected. This may seem like a long list, but most girls will only have a few features, so treatment will differ from person to person. For the main features of short height and ovary problems, hormone treatments can be used. Estrogen and progesterone can be replaced by taking a tablet or patch. For short height, growth hormone may be given by injection to help a girl grow as tall as she can. Nearly all girls with Turner syndrome will also be infertile, but can still have children through techniques like IVF. So, although there's no cure for Turner syndrome, with treatment most girls are able to live long, normal and healthy lives. It is important to get routine checkups by doctors to pick up on any potential problems early on. As Turner syndrome can affect many different parts of the body, a team of specialists may be involved, such as hormone specialists, psychologists, heart specialists, and kidney specialists. In this health sketch, we've talked about the genetic cause of Turner syndrome, the main features of short height and ovary problems, how this can be treated with hormone therapy, and the wider symptoms that can occur. We hope this health sketch has been helpful for you and those around you. Health sketch. Health.
Okay, so here we got to know about Turner syndrome as well. Now what we'll do is we'll look at Klinefelter's. So before we look at Klinefelter's, I want you to look into your book and just read over what is Klinefelter's and to whom does it occur and what are the general symptoms of Klinefelter's. All of you read the page of Klinefelter because this is the last disease we are looking at. And then we are going to discuss. Everybody read through, you get a basic idea, and then when we see here, you understand better. Everybody read through Klinefelter. I've only received information from Amrita saying that she has problem with her net, and Sakina. The rest of you should have your cameras on. Ashia, Sampanna, Safal, Rasa, Maharjan, please make sure your cameras are on. Rafika, please make sure your camera is on. And read through Klinefelter syndrome. Chirag, Arnav, please make sure your cameras are on. Once you've read through, please give me a thumbs up so that we can go ahead discussing with Klinefelter syndrome. Okay, Akisha has completed reading. What about the rest of you? I don't see a thumbs up. So let me ask you, Klinefelter's occurs in boys or girls?
Boy.
Boys, okay. What happens in Klinefelter? According to normal chromosomal setup, we have to have 44 autosomes and 2 sex chromosomes, X and Y in case of the boys. But in Klinefelter's, what do you find? They have extra copies of chromosome X. So instead of having only one X and one Y, they may have two X's and one Y. In some condition, they can have three X's and one Y also. So when they have more of the X chromosomes in the sex chromosome, where they are supposed to have only two, instead of two, if they have three, sometimes even four, then that condition is known, or that syndrome, which has a collection of symptoms, then that syndrome is known as Klinefelter's. Now, what are the main symptoms that you find? If you look at this picture, this represents a person having Klinefelter's. There's lack of body hair and lack of beard, okay? The person seems to have long arms. They're relatively taller than their friends. Any boy who's suffering from Klinefelter's, the testis and the penis is also very poorly developed. They have very long legs and long arms, okay? And a very important feature is gynecomastia, which you find that there's more accumulation of breast tissues, and there is an enlargement of the breast that is seen in the men. So, and there's also lack of pubic hair and other body hair that is there. Very poorly developed secondary sexual male characters as seen in a person who suffers from Klinefelter syndrome. And because of this, in totality, they are usually sterile and not capable of reproduction. They are infertile. But with therapy, because the testosterone level is very low in a male who suffers from Klinefelter, but again with hormonal supplements, this can be overcome. So what happens? The person appears like a male, but during the teenage, you can find that after puberty, the mammary glands or the breast develop because of a development of tissues around the breast. So they have very less muscular body. They are generally tall and they have very long limbs and hands and legs. And both the testes and the genitals are very poorly developed. The IQ is also mildly impaired, but the intelligence as such is not affected. So let us see what are the conditions that we find in Klinefelter. So I think this video will tell us much more.
Hello. In this health sketch, we want to talk to you about Klinefelter syndrome, a genetic condition that affects boys. It is named after Dr. Harry Klinefelter, who first described the condition in 1942. Around the world, roughly 1 in every 600 boys that are born will have Klinefelter syndrome. Why does Klinefelter syndrome occur? Unlike other genetic conditions, it is not directly inherited from parents, although older mothers or fathers may be at slightly increased risk of having an affected son. The condition happens randomly when the genes are first formed. Our genes are like a code which determine how we look and how our body works. All of these genes are wrapped up in 46 chromosomes, which are found in every cell of the body. Of these 46 chromosomes, one pair is different between boys and girls, the sex chromosomes X and Y. Girls have 2 X chromosomes, while boys have an X and Y chromosome. However, in Klinefelter syndrome, there is an extra copy or copies of the X chromosome. Most commonly, this means that instead of their chromosomes being 46 XY, there are 47 XXY. The extra X chromosome means that their bodies develop slightly differently. The testes do not function properly and produce less of the hormone testosterone. The syndrome is very variable, and some boys have very few obvious symptoms. In fact, many people with Klinefelter syndrome will go through life without ever being diagnosed. However, the lower levels of testosterone and the extra chromosome can lead to some of the following features: reduced fertility or infertility, being taller than expected and with slight changes to body shape, lower muscle tone and strength, less facial and body hair, sometimes more breast tissue called gynecomastia, low mood and anxiety, finding social situations difficult, low energy levels. difficulties in some thinking skills used in daily life, such as planning, focusing attention, and juggling tasks, changes to behavior and learning, such as language development difficulties, although intelligence is usually unaffected. Apart from these features, men with Klinefelter syndrome also have a slightly increased risk of developing other long-term health problems, including weak bones, type 2 diabetes, heart disease and blood clots, autoimmune disorders, dental problems, increased risk of male breast cancer. These may seem like a long list, but the condition is very variable, and most will experience few problems. However, if you suspect Klinefelter syndrome, then it is worth seeing a doctor to get a formal diagnosis, as treatment and support can reduce the chance of problems developing. Diagnosis is confirmed by a blood test, which checks for the extra chromosome through a genetic test. For adults, other tests can also be helpful, such as checking blood testosterone levels and fertility tests such as sperm count. While there is no cure for Klinefelter syndrome, testosterone replacement therapy is effective for treating some of the symptoms. This is usually not required until after puberty, and it can be provided in various ways, such as gels, tablets, or injections. Other possible interventions include speech therapy, physiotherapy, and occupational therapy, educational and behavioral support at school, and psychological support. There are now fertility treatments which may help some to father children. Increasingly, multidisciplinary clinics are bringing these wide-ranging services together. It is important to remember that most people with Klinefelter syndrome will lead normal and healthy lives. However, it can be upsetting and confusing to first learn about a new condition. Patient support groups are available to connect with other patients and families who may have gone through similar experiences. In this health sketch, we've talked about Klinefelter syndrome, which is caused by an extra X chromosome in boys and leads to low testosterone levels. We describe the common features of the condition, how it is tested for, and the main forms of treatment, including testosterone replacement. We hope this health sketch has been helpful for you and those around you.
Okay, now this is much more information about the Klinefelter, and I'm sure you've understood a lot about Klinefelters by looking through this video. So for Downs, for Turner's, for Klinefelters, we've understood much, but then there's something else that requires a little bit of attention. All of you just carry on watching here what I have to show you. Just give me a little bit of time. Because along with these, there's one more disease that that they usually ask about, which is not here as such, and that's
health for all to see.
Okay, where what's happened here? Now let me go back to another disease that's called hemophilia. Okay, we need to know something about hemophilia. So hemophilia is also called bleeder's disease. Okay, it's called bleeder's disease because what happens during this, a person who has hemophilia has the clotting factor missing. Okay, the protein that helps in the clotting of blood. For example, it's normal for us to get injury. It's normal for us to get cuts. And whenever we have injury or cuts, what happens? Blood flows out for some time. But then what happens after some time? Blood starts to clot. It becomes thick and stops to flow. But in case of those people who suffer from hemophilia, they have a problem in clotting of the blood. Okay, and it's been there in the royal family. This caused a lot of loss of humans because of the disease hemophilia. An entire royal family got wiped out because of hemophilia, which is also a genetic disorder again. So what are the two symptoms? You can see excessive internal or external bleeding may occur. There may be hemorrhage, internal hemorrhages, because internally also capillaries can break open. There may be blood loss into our body cavity, into our coelom, so causing major fatal condition. Okay, and sometimes when very thin blood vessels inside the nose rupture, then also it's known as a spontaneous nose bleeding. These nose bleeding can also be dangerous because even in minor cuts and minor injury can lead to excessive blood loss in case of people suffering from hemophilia. So I also want you to look at this video on hemophilia so that you have a more understanding on it. Okay, so just watch this.
So, what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit worldhemophilia.org.